Today we are going to learn about prescription. Prescription is a legal document or a order written by a qualified healthcare professional for the diagnosis, prevention or treatment of a disease. Here parts of prescription are date, patient information, superscription, inscription, subscription, signature, prescriber information, refill, warning and label. First one is date. For any type of format, we need to enter the date properly. Here all the prescriptions expire after 1 year. In case of narcotics, habit forming drugs, the date prevents the misuse of the drug by the patient. Patient information like name, address, age, weight, time, and sometimes used only with the inpatient medication orders. Need to mention at the top of the prescription. Superscription, which represents by the symbol RX. It is a traditional symbol for the prescription. It is derived from a Latin word receipt, which means to take. So instructions given to the pharmacist as well as patient to take the medicines as prescribed. Here, and the theory is that it derives from the symbol for the god Jupiter. The connection to healing was via prayer that specific treatment would be effective and individual would get better. So for this purpose, RX is mentioned at the top of the prescription. Next is inscription. It is the main body of the prescription, which includes name and the quantity of a medicine which are prescribed. All medicines are written in separate lines along with the required quantity needed to treat disease. It is filled completely by the prescriber. Next is subscription. These are the instructions given to the pharmacist for dispensing the number of doses to the patient, and also how medicine to be taken before meal or after meal. So it is the indication given by the prescriber to the pharmacist in order to give that information to the patient. In India, the medicines are dispensed to the patients readily without any compounding at the time of dispensing. But whereas in case of foreign countries, they have a separate compounding section itself in the hospital. So at the time of dispensing itself, they will compound and then dispense the medicine to the patient. So at such conditions, this subscription information is important for the pharmacist to compound the medicine. These instructions are given by the prescriber itself while writing the prescription. So according to the prescriber given schedule, the pharmacist compound and submit the medicine to the patient. And next one is signed signature or transcription. It is instructions to the patient regarding route of administration, that is the product to be taken orally, normally or nasally or rectally, etc. And also if taken by mouth, so whether it is needed to be chewed or swallowed, like that. Number of dose units per dose, so that is take 1 tablet, give 2 tablespoons, like that. And next one is frequency of dosing. So the frequency of dose is needed to be mentioned in the prescription itself, that is every 6 hours, once a day, twice a day, like that. And next one is duration of your dosing, for 7 days until gone, if needed pain, like that. The next one is purpose of medication. So for pain, for asthma, for headache, so all these indications are needed to be mentioned in the prescription by the prescriber for the patient. A very important to include purpose, as this reduces the errors as directed by the physician. Okay, and then special instructions like shake well, refrigerate properly. If there is any warnings, those are also to be needed to be mentioned while writing the prescription. And next one is refill or renewal instruction. It indicates either no refill or number of refills you want. It indicates maximum duration of your therapy actually. And next one is signature or address of a prescriber. This makes the prescription a legal document. Sign, prescriber registration number if necessary, and address of a prescriber are needed to be mentioned at the bottom of the prescription. So this is the final format of a prescription. At the head of the prescription intimates the doctor's name, qualification, example MBBS, MD, like that. After that his registration number, and then full address, contact number are needed to be mentioned at the head of the prescription. A later date, So fill the date properly and the name of the patient, his information like address, age, weight, sex, like that needed to fill. After that mention the RX and then the name of the medicines which are needed to be prescribed for the patient regarding his disease. After that the strength, dosage instructions, duration of therapy, like that we will mention, and then the direction for the use. If there is any directions for the use, needed to mention that one also, and then the name of the pharmacy, pharmacist name, city, like that at the end we will present. After that doctor sign and stamp are highly needed to make it a legal document. So this is about the prescription. Thanks for watching this video. Please subscribe our channel for more videos.